Hi, everyone, and welcome to the Indoor Air Quality Safe Practices training. The purpose of this training module is to explore healthy and safe practices for businesses, including those that are home based, related to indoor air quality. At the completion of the training, each participant should be able to 1. Identify different ventilation and filtration methods, 2. List and describe specific actions to improve indoor air quality, and 3, determine at least one or multiple actions they can take at their facility. Why is indoor air quality important? Indoor air quality refers to the quality of the air in a home, school, office, or other building environment. It is important because, on average, Americans spend about 90% of their time indoors, where the concentrations of some pollutants are often 2 to 5 times higher than typical outdoor concentrations. Here are some common types of indoor air pollutants: airborne particles, house odors and gases, microbes and germs, and volatile organic compounds, or VOCs. Examples of airborne particles are vehicle exhaust, dust, and wildfire smoke. Some examples of house odors and gases are trash odors and sink or drain odors. Microbes and germs, such as viruses like the flu or COVID, and mold. And volatile organic compounds, or VOCs, such as cleaning supplies, paints, and nail polish. Here are some household activities to improve indoor air quality. Do not use scented products to cover up odors in the home. Air fresheners do not clean the air, they instead add chemicals that can contribute to poor air quality. Damp dust and mop frequently. Use a vacuum with a HEPA filter, and avoid burning candles or incense indoors. Although this is a very common traditional practice amongst many cultures, it can actually do more harm than good. Here are some more household activities to improve indoor air qualities. So do not smoke indoors, don't wear shoes inside. On polluted days, avoid using gas cooktops. Instead, choose electric or induction cooktops when you are able to, and avoid broiling or frying foods. Here's a chart that illustrates the major causes of poor indoor air quality. As you can see, here in the biggest section is inadequate ventilation. So this is a major cause of poor indoor air quality, followed by inside contamination. So this is with things like chemicals or air fresheners and things of that sort. Here we have, and the third leading cause is unknown causes, followed by outside contamination, bioaerosols, and lastly, building products. The effects of poor indoor air quality. Human health effects associated with poor indoor air quality include respiratory diseases like asthma and chronic obstructive pulmonary disease, or COPD, heart disease and cancer, headaches, dizziness, and fatigue. It also adds to irritation of the eyes, nose, and throat, cold or flu-like symptoms, and makes existing medical conditions worse. Over the past decade, researchers have found that high levels of air pollution may damage children's cognitive abilities, increase adults' risk of cognitive decline, and possibly even contribute to depression. So, who are the most sensitive groups? The most sensitive groups of people to poor indoor air quality include young children, pregnant people, people with respiratory diseases, heart disease, or chronic diseases, people over the age of 65, people who have or had COVID-19, and people experiencing the effects of environmental inequity, such as living near an airport or industrial area. So, ventilation and filtration. This is a very important concept, and it's very important for us to learn the differences between the two topics. So, ventilation is bringing in fresh air to dilute the air that you have inside, and filtration is actually capturing and removing the particles from the air. So, this would be a filter that is actually placed within the building or the home itself. So, there are different types of ventilation. there are natural sources of ventilation, such as doors and windows, and then mechanical sources of ventilation, such as HVAC, so heating, ventilation, and air conditioning. You can also use fans and exhaust systems as well. So, when it comes to natural sources of ventilation, if weather and air quality permits, bring in as much fresh air as possible by opening doors and windows. Fans in a window to blow potentially contaminated air out and passively pull in new air through the other open windows and doors actually works as well. For mechanical sources of ventilation, the HVAC system, or heating, ventilation, air conditioning system, is comprised of one or more handling units that pull air in from the outside and circulate the air throughout the building. The local exhaust, such as bathroom fans or kitchen hoods, should be running whenever the building is occupied because this pulls air out of the building and actually brings new air in. Tips on using portable fans to improve airflow. Place a fan as close as possible to an open window blowing outside. This helps reduce air pollutants, including virus particles. Even without an open fan, fans can actually improve airflow. If you need a fan to improve airflow or during hot weather, avoid blowing air from one person to another to prevent the spread of germs. Point the fan away from people. Where is your air coming from? So your air. So here we have a picture of a supply air grill, which actually supplies air inside the building. And then down below we have a return air grill, which removes air out of the building. So now that we know where our air is coming from, okay, how to start? First, start by locating your return air grill, which is this picture at the top here. It's usually located in the center of the building. Secondly, are your supply diffusers blocked? If so, check by opening them up. Lastly, are your return grills dirty or blocked? If so, use a simple brush to clean it up. The tissue test. To identify between your return air grill and your supply air grill, you can use a tissue test. If the tissue is being pulled in, right here, like this, that is your return air grill. And if your tissue is being blown out towards you, that is a supply air grill. Some solutions on how to improve indoor air quality include, if you have an HVAC available, upgrade the filters to the highest rating the system can safely handle. We recommend MERV 13 or an equivalent rating. We also recommend bringing in as much outdoor air as your system can handle, aiming for 100%. Open a window when your outdoor air quality is good. And lastly, use a portable HEPA air cleaner unit. Look for units that blow filtered air upwards, as you can see on the picture to the right. Bad ventilation. So here is an example of bad ventilation. Um, so there is no ability to bring in outdoor air through HVAC. There's no open windows, or you're unable to open windows. There's no filtration device to help filter the indoor air. So here on the picture on the left, we can see that there is a huge concentration of pollutants in the air, and we don't have any windows open, we don't have any fans, we don't have any filtration devices. And then as you can see, it is 2:30 p.m. in this picture, and when we look to the right, it's 3:30 p.m., and we can still see, although it has decreased, there's still a good amount of pollutants in the air. An example of good ventilation is when we have a good HVAC system that can efficiently bring fresh air from the outdoors into the indoors and filter any recirculated air. Ceiling fans are used to pull air upwards, as we can see in this picture to the left. Windows are open, allowing for fresh outdoor air to come into the home. And then we have a HEPA air cleaner that is filtering the indoor air. As you can see, the timestamp on the picture on the left is 2:30 p.m. And an hour later at 3:30, we can see there are no pollutants in the air. And this is an example of good ventilation. Some tips for where to place HEPA air cleaners. You can place HEPA air cleaners in areas where people spend most of their time, so where they tend to gather. And you can also, and you should place them at least a foot away from the wall or other items. In this section, you can see that there's a little dining table where people tend to eat together. This would be a great place to place a HEPA air cleaner. Another great spot would be right here in this little sitting area, as you can see, because people tend to gather here. It is unsafe to open windows when there's poor air quality. So when do we have poor air quality? So examples of this would be underneath airplane pathways, during wildfire smoke season, when there's heavy traffic in heavy traffic areas, industrial areas, and areas where safety is a concern. Guide to air quality index. As you can see from the illustration, when the air quality index is green, the air quality is good. So this is between 0 to 50. When it's yellow, the air quality is moderate. Orange, unhealthy for sensitive groups. Red is unhealthy for all groups. Purple indicates the air quality is very unhealthy. And burgundy, or this dark red color, indicates the air quality is hazardous. So this is actually used to measure outdoor air quality for 5 major pollutants. So particulate matter, or PM, which is the most common air pollutant, ozone, or vehicle emissions, and industrial emissions, carbon monoxide, sulfur dioxide, and nitrogen dioxide. On this picture, you can see the air quality index in the state of Washington. As you can see, is all green, which indicates good air quality. Here, we see that there's a lot more going on. We see a bit of purple, we see a bit of red, yellow. So this actually shows that the air quality, if it's yellow, is moderate, and areas where it's burgundy is hazardous. And this is why it's very important to check the air quality of your area. You can also visit the Puget Sound Clean Air Agency website at www.pscleanair.gov to get a forecast discussion on the air quality of the week. The EPA also has a great website where you can just put in your zip code as illustrated in the picture on the left to get your air quality index where you live. And then as shown on the image of the right, after entering your zip code, you get the current air quality of the area. And their website is www.airnow.gov. Lastly, I want to emphasize that adding multiple layers of protection improves success. Protecting your family and clients isn't just a one answer solution. It requires multiple actions for our community to be safe.
Thank you for joining our Indoor Air Quality Safe Practices training. To learn more or for more information, please explore our website for more valuable resources. Thank you.